Hi guys, we are here at the Great Neck Clinic and we have Kevin. Say hey, Kevin.
Hi.
And we have Crystal on the virtual treadmill, which is really interesting. So they're actually, I move my fingers out of the way, they're discussing her gait pattern. So what she's aiming to do is hit the blue boxes. So you can see this machine picks up how she's weight bearing, where she's weight bearing, her stride length, her heel toe pattern, whether she needs to increase her stride length or reduce her stride length. And then this little machine that Kevin's tapping on, it shows you can increase the speed. Kevin, do you think we should put an incline on? So we're going to make it harder for her. Oh, she's got it.
Earlier was a little bit slower.
So she's now into the pattern. You can see where she's hitting.
Contact time here pretty even, step line pretty even, step line pretty even, so good job.
So she's doing well. Thanks, Kevin. Kevin's one of our physical therapists here at Reddy Care. He is a doctor of physical therapy and he is used to treating in clinic and in our home setting. So you can see that she's actually attached to a red cord. That is just in case the patient suddenly needs to stop. If you stop as a body, the machine will cut off. So it's just an extra safety mechanism. This machine has been cleaned, wiped down. You see how you're getting that. This machine is so fantastic because you get that visual feedback. So not only is the physical therapist able to give feedback to the patient verbally, they're able to use this information so the patient can see. As physical therapists, we look at step length, especially if someone's favoring one side. We want to make sure that left and right are equal. You can see with Crystal, her left, oh, she's changing it now. So her left is a little bit higher. You can see again, she's favoring a longer step length on the left. This might be because she likes to spend more time on her right leg. Looking at step height, that's how much clearance that she has. Keeping it pretty equal, and how much contact time she has. So both feet are in contact with the ground for the same amount of time. I love the camera on this as well because you can see how you look when you're walking, which is such a rare thing to be able to see. So if someone's always swaying to one side, they can physically see that they're swaying on this machine rather than just having to take the physical therapist's word for it.
What would be a reason why someone would have to use this physical therapy?
So let's say we had a patient who had a ankle fracture and has been non-weight bearing. Let's say they did non-weight bearing 4 to 6 weeks depending on where the fracture was, and they're now coming out of a boot, they're starting to learn to walk again, and they're favoring one side over the other. So if they had their fracture on the left side, they're likely to be favoring that right side, so they'll spend more time in contact with the ground on the right to offload the left. They're likely to have a shorter step length on the right, because with a longer step length on the right, you're going to have to take the weight off the left, and then when you put the weight down on the left, you want to do a very quick step through so you're not having to weight bear. They may also be swaying from side to side. They may be doing the feet next to each other, so not a step through gait like you are. They might do it one foot meeting the other foot, meeting the other foot, and again, that's to reduce the weight they're putting on it. So this is just good for them to see. Also, any athletes who are having trouble with their running, if they were looking at the gait analysis and we wanted to see where they're struggling and maybe why they had an injury, this is a good way to look at if they're favoring one side when they're running and how to change their running to suit their condition. You wouldn't ever see this piece of equipment in the gym. This is very state-of-the-art and very specific to physical therapy.